And then we continue to see a significant number of school-linked cases in K-12 settings that, along with people in their 20s and 30s, seems to be kind of where the action is related to other cases that we're getting. Um, the the seem to continue to have good capacity at Bozeman Health. I'll let Kallie talk about that. The census that I saw this morning was we had 5 people with COVID. I think only 1 in critical care. So that continues to be promising at Bozeman Health, at the hospital, the main hospital there. The other thing I wanted to talk about is we're seeing now enough vaccine, that we're really seeing an ability to be able to meet demand. We are seeing our points of dispensing that are happening at the fairgrounds. When we invite people to those are we continue to see open slots available. We think the list of people that have said that they want vaccines, we're really moving through that. We've been doing some work with MSU this week, late this week, to reach out to their folks to make sure that they know that that's an availability. And then I think what we're also seeing is open slots at Bozeman Health. So we're going to be making some efforts to really do some outreach to get those pods filled. The bottom line is, if you've been waiting, now is the time. We have points of dispensing up and running at the fairgrounds. We have points of dispense. Bozeman Health has points of dispensing going up at the hospital. We're in Big Sky, in West Yellowstone. There's some shots being given, and MSU is working hard to give out shots. We are all working hard to build that capacity. We really need the community to utilize that capacity while it's available. Right now, we have shots available. They're available. It's quick. It's easy, and it's free. And when you come to the fairgrounds, that's not going to last forever. We really want people to go to healthygallatin.org or to go to the Bozeman Health site, get signed up for those vaccine slots. If you're at MSU, you should have gotten an email from the administration providing some access there. Now is the time. We need people to take advantage of the opportunity we have. We've built these machines to give these shots out. We won't be maintaining them forever. I'm not saying we're taking them down tomorrow or even next week, but we need to continue to get people through those facilities in order to make that efficient. Of course, the vaccine is going to be available down the road, but now is a really good time, especially going into the summer. Keep in mind, if you start getting vaccinated now, you've got a 3 or 4 week wait before your second dose, and then about a 2-week wait until that immunity has really been established. You're going to be into the summer. You're going to be into the high tourist season. We're going to have a lot of people moving through here. It's a really good time because it's accessible, and it's a good window of opportunity to get those shots. So we really want people to take advantage of that. To go to healthygallatin.org, go to Bozeman Health's website, or connect with the emails that MSU is sending out. We have the capacity, we have the systems built, and we're ready to give you shots if you want them. With that, I'll throw it to Kallie, since I talked about the census up there. Kallie, do you have anything to add to what I talked about?
Yeah, I think just letting everyone know that our vaccine appointment sign-up links remain on our website for both Deaconess and Big Sky. And I want to remind everyone that the Bozeman Health vaccine clinics are for the signups on our website are specifically for people seeking first dose vaccine administration. And at the time of their first dose appointment, they will be automatically scheduled for their second dose. We need to remind everyone that all residents need to return to the location where they received their first dose to receive their scheduled second dose. At this time, due to how we receive vaccine allotments, we are unable to accommodate pre-scheduling individuals who just need a second dose at this time. However, that being said, there may be cancellations at the end of the day where we can accommodate a small number of second doses, but we are not scheduling those at this time. And if anyone needs to confirm whether or not they can receive vaccine through Bozeman Health, they're encouraged to call our hotline, which is 406-414-2620, and they can speak to a vaccine scheduling specialist if they should have questions. That's all that I wanted to really stress today. We seem to be having a bit of confusion surrounding the ability to schedule first and or second doses only through Bozeman Health.
Thanks, Kelly. Tracy, what do you got?
So many thanks to Gallatin County for, working with us in terms of making vaccines available. And Matt's exactly right. We yesterday really began a very heavy communications campaign to remind students, faculty, and staff that there are vaccines available. So we started yesterday with emails and websites and social media posts. We're texting today and then repeating with more emails and social media posts, and really pushing hard to get the word out that kind of the tides have turned on vaccine available, and this is a great time for people to get vaccinated. And that's great thanks to Gallatin City County Department of Health for that.
Thanks, Tracy. Just some, we're as we look at overall what we're seeing, earlier this week we had, I think, just over 58,600, just under 58,700 doses administered in Gallatin County. That includes about 39,000 first doses. We're at a point now where we've got about, we think about 23% of the county fully vaccinated, and I think we're at significantly higher than that for first dose. When you look at kind of overall what we're seeing by age group, that's pretty promising. We're seeing about 90% of people 80 and over have gotten at least one dose of the vaccine, and 78.6% of them have gotten two doses, and that's countywide. People in their 70s were just over 71% have gotten their first dose, and just under 55% are fully vaccinated. When you go down to people in their 60s, we're at about 32, about a third of them are fully vaccinated, but about 60% of them, 63% of them have gotten at least one dose. So in those older age categories, we're making progress. We're also seeing, I think we're up, I'd have to do the math real quickly here, and I will do that. So we've got about 39,000 people who have gotten one dose. I believe we're at about 41.5% of the population of Gallatin County who's eligible for the vaccine have gotten at least one dose of the vaccine. That's not at this point in time, that's not close to herd immunity. It's not close to the 70 or 80% that we'd want to see to be able to get to that population level immunity that we're after. But we're going to continue to churn. We really need people to continue to come in and get those shots. We're going to be continuing to think about ways to do that outreach, but we're not done. We have a lot of work to do, but it is promising that we have enough vaccine now to be able to at least satisfy the immediate demand that's out there. With that, I'll throw it open to questions.
Hey Matt, it's Nora with the Chronicle.
Hi, Nora.
Hey, I was first wondering, and you kind of touched on this a bit, but I'm wondering about like what are some of the challenges do you think that will you guys will have to tackle when it comes to getting to that other half of the population who hasn't been able to or hasn't been interested in getting a vaccine yet?
Well, I think there's a couple things. There's, with any vaccine, there's vaccine hesitancy. We're used to that, whether that's the influenza vaccine or whether that's childhood vaccines. That's about communicating. It's about listening. It's about making sure that we're sharing information and really we're hearing from people about what their concerns are and addressing those concerns. And we're used to that. We'll continue to do that. The other issue sometimes is convenience. People are busy and just making sure it's available and it's easy for them. And so as we move down the road here, we're going to be looking for ways to make it really convenient, to make it really hard not to do it unless you really are making a conscious decision not to do it. And that means making it available, making it quick, making it easy, whether that's in workplaces, whether that's outreach like we're doing at MSU this week, whether that's outreach to churches. We're thinking about those sorts of things. And so I think it's those two things. It's making it convenient and then making sure that we're really listening and we're really hearing what people's concerns are about the vaccine.
Okay, thanks. And I was also wondering, excuse me, it's a little different. Sorry, excuse me.
That's all right.
I know Big Sky is ending their season, I think either Sunday or Monday. So I'm wondering, just kind of as like looking back at the winter, how do you think it went up there when it comes to COVID with the surveillance testing?
I think it went great. They did a nice job. There was a lot of testing available. They really did a nice job sharing that data with us. I know it was a challenge. Some of the contact tracing that was happening, that was, a challenge that we all deal with. But they were really coordinated with us and we really appreciated them. And they provided that resource in a way that didn't detract from the testing capacity in the Valley, which is really was a concern of mine going into the season. And their positivity rates were consistently pretty low throughout the season. And so that's encouraging too. I think it demonstrated the power of a really strong surveillance testing system when it can be fun. It's expensive though. I mean, they spent a lot of money on that. And I think it can be a lesson learned for the state, for the nation about how we build our capacity to deal with this in the future.
Okay, thanks.
Sure. Other questions?
Hi, this is Jess with Yellowstone Public Radio. Can you hear me all right?
I can, Jess, go ahead.
Okay. So we're interested in how variants are spreading in Gallatin County. Are there currently any clusters or any age groups in particular?
We know we've had more variants identified in Gallatin County. I think we were up to, I want to say in the 30s earlier this week. I think the other county that had a significant number was Missoula at 20, and no other counties were close. The tricky part of that, though, is how much testing is being done in the counties to really understand if that's an artifact of the testing, of more testing that we're doing, or if that is an indication that the variants are here to a greater degree than they are in other places. I suspect it's a mix of those two things. We have the busiest airport in the state. We have the largest university in the state. We have a very fast growing population. A lot of people coming here even now to visit Yellowstone and do those sorts of things. So I think it's a combination of those two things. I think we still have a long way to go to have the level of testing that we need to be able to answer the questions that you're asking. We don't know. We don't do enough testing in this country, and we probably don't do enough in the state to really have an idea to be able to answer those questions. I would say this though, when you're talking about the variants, we make the assumption that the variants are here. We know that they're here. We've seen the UK variant, the California variant, and I think the New York variant to varying degrees in Gallatin County. You make that assumption that they're here. It doesn't really impact how we do our work in public health. Our contact tracing continues on the same way we would normally do it. We're still working our rear ends off to get shots out there, and we're still giving the guidance to people when we know those variants are here, even when they're not here, to continue to use face coverings, to continue to do that social distancing, to continue to help us slow down the spread while we give those shots out. So at the retail local public health level, it doesn't make a lot of difference to how we go through our day-to-day operations. But what can help with is communications, making people aware that those variants are here. I don't think that we have a system in this country at this point in time to really be able to answer the kinds of questions that you're asking right now.
That totally makes sense. Going back to the testing process, does the county do its own variant testing, or how does that process work?
Some of the testing that we got early on was happening at MSU, and those were researchers who, out of their own curiosity and the technology they had, were doing some of that genetic sequencing and passing along specimens of interest to the state that would then be sent to a CDC certified lab. Everything else beyond that really is run at the state level, and they go to a certain number of CDC labs that are validated to do that. I think the closest one we have is the one in Wyoming, at least the last time I checked. So those are really state level and federal level questions that would have the best answers for those kinds of questions.
Thank you.
Yeah, you're welcome. Good questions, though. Other questions?
I did have another one if no one else
Sure.
has any. You mentioned last week, I think it was 1 or 2 bars that the county was kind of looking into some complaints. So I was wondering if you had updates on that.
Yeah, we asked the police department to look into a complaint related to Bar 9 on Main Street. They followed up on that and had a conversation with the owner, as did I, and we're going to continue to monitor how those things are going. We can share those complaints if people are interested in them. I think for the most part, bars and restaurants are really making a concerted effort to follow the rules. But we are seeing some signs that there's some fraying around the edges and maybe some places where there's not total compliance. It's difficult though. Some of these complaints are generated from postings on social media. And so really nailing down the facts can be difficult in those circumstances. And that's why really at this point in time, what we've been doing is having conversations with bar owners. We've asked the Bozeman Police Department to look in and to monitor those situations, but we're really relying for the most part on the hard work of the people who own and run those establishments to continue doing what we need to do to slow down transmission. I think that's happening. I think there are some instances where it's a problem.
Okay, gotcha. And I was also wondering, do you have any thoughts on the governor's, I think it was an executive order banning vaccine passports?
I don't really. I mean, we're at a point in time where we were considering doing vaccine passports. I think as we move through this, I think allowing organizations to make those decisions that's best for those organizations, allowing locals to make those decisions it would be really helpful. I hear a lot about local control in the state of Montana and people elected to office. But what I've seen happen coming from Helena is kind of counterintuitive to that. We're seeing a lot of push to tell locals how to run their business, to tell businesses how to run their business, to tell schools how to run their business, rather than letting them do it themselves. So I hear a lot about local control. What I'd love to see is some actual trust and allowing locals and businesses and others to actually execute that local control.
Okay, gotcha. Thank you.
Other questions? All right. You all have
sorry, I also have another question, if that's all right. You said that cases were leveling off and the positivity rate is also leveling off. Are there any guesses to what is driving those trends right now?
Well, they're educated guesses, Jess. I mean, what we've seen is we saw it happening was really promising going into spring break. is we were coming down under 25 cases per 100,000. We were coming down under 5% positivity. That was going along pretty well. And then we came out of spring break and things started ratcheting up. And I think you had a combination of a couple things happening. People went away and they came back, and we started to see cases related to that. So there may be some issues related to some of the K-12 schools. Montana State was here. Montana State didn't have spring break. I'm talking about the K-12 schools spring break. There were people traveling, and I think that may have had an impact. I think the other thing that we're seeing is some evidence that people are losing patience. And they're feeling like the vaccine is here. They're letting loose, and some of the behaviors, some of the mask wearing, we're getting more complaints about mask wearing or lack of mask wearing. And so I think that there's some things related to that too. When you're looking at our numbers, we're seeing the increases really being driven by people in their 20s and 30s. And when you pair that with some of the complaints that we're getting, it's hard to think that doesn't have some relationship to the higher number of cases. Now, we came out of spring break. It's been a couple of weeks since spring break. People are back at work. People are back at school. And maybe things are leveling off. We have seen, seems like we're seeing more cases in schools, and we're seeing more cases in people in their 20s and 30s. And I think those are groups that tend to be out there and mixing and more likely to spread from one person to the next. We're hopeful, but we're watchful. I mean, it was good to see the numbers level off, but we're still significantly above that level where you want to be to really start to see a retraction in the amount of spread that we have in the community.
Thank you.
You're welcome. All right, last call. Okay, thank you all. I really appreciate your time. Really, please urge everybody who's out there, urge those, if you know anybody, especially people in their 60s and 70s and 80s, if you can help them get a shot, help them get them in, urge others to come in and get their shots over the next couple of weeks, because we really have the capacity. We want to put it to good use for people. Thanks all.
Thanks, Matt.